So a coarse reticular pattern is usually caused by pulmonary fibrosis. This is also referred to as honeycomb lung because of the presence of coarse reticular opacities with intervening cystic spaces, so it produces the appearance of a honeycomb. Usually this results in progressive volume loss. We have what's called traction bronchiectasis, so widening of the bronchi because of pulling from the fibrosis that's surrounding it. And this often results in end-stage lung disease. So the most common causes include, as we mentioned, idiopathic interstitial pneumonia, but other causes could also include sarcoid, collagen vascular disease, different types of drug reactions, or it may be idiopathic. So let's take a look at the different findings of pulmonary fibrosis. On the left, we have an example of a radiograph that's coned down to the right lower lung, and you can see coarse reticular markings. You can see them outlined here by the arrow. So again, very coarse reticular markings, you can see them appear as well, just prominence of the interstitial spaces. On the right two images, we have honeycombing and traction bronchiectasis. So let's take a good look at each of these. So here we have a better example of what honeycombing could look like on a radiograph. So you can see prominence of this interstitium with an intervening cystic space right here. You also see prominence of the interstitial markings up here outlined by the circle. On this, we have an example of honeycombing, again with prominence of the interstitial markings and intervening cystic spaces, causing the appearance of a honeycomb. And this last image shows a dilated bronchus. Again, this is an example of traction bronchiectasis. So we have surrounding scarring and fibrosis, which pulls on the bronchi and causes them to enlarge. So the remaining two types of patterns seen with interstitial disease are nodular and reticulonodular. So we've seen an example of reticulonodular with metastatic disease. Let's take another look at some examples. So other things that can cause a reticulonodular pattern or a nodular pattern are hematogenous metastases, which can spread through the bloodstream. And again, the common causes are renal cell, testicular, breast, colon, melanoma, sarcoma, and ovarian. These usually produce more of a nodular pattern and somewhat less of a reticular pattern. So this is an example of varying nodules of different sizes. You can see them throughout both lungs, and this is an example of hematogenous metastases. So you can see the interstitium actually looks somewhat normal here. It's really just the multiple nodules that we see. So on a chest x-ray, whenever we see multiple nodules like this, one of the things that should come to mind is metastases. Bronchogenic carcinoma can also produce this pattern. This is an example that I'm about to show you of an adenocarcinoma of the right upper lobe. So although lung cancer can produce multiple different nodules, usually the initial presenting sign is a single large nodule like we see here. That it's pretty well circumscribed. And this can be confused with a consolidation. So usually to differentiate, what we would do is we would treat the patient. If there's any thought that this might be a pneumonia, you would treat the patient with antibiotics and then do a follow-up chest x-ray to make sure that the finding has resolved. So tuberculosis can also cause multiple nodules. This is an example of primary tuberculosis. You can see that there is multifocal consolidation. Rarely you may see a cavitation, and usually if it is seen, it's in the right upper lobe. And you can also see ipsilateral hilar lymphadenopathy. Primary TB can also produce pleural effusions, which we don't see on this radiograph. So reactivation TB can produce a different pattern upon presentation. This is usually caused by reactivation of a primary focus that's acquired during childhood. Usually this presents with consolidation, often cavitary, that are localized to the upper lobes and the superior segments of the lower lobes. Here you can see bilateral upper lobe consolidation. Healing usually results in fibrosis. So you can see another area of consolidation here involving the lingula and the left upper lobe. Sarcoid can also present with multiple interstitial nodules. So sarcoid initially presents with bilateral hilar and right paratracheal lymphadenopathy, and it often has a mixed reticular and nodular interstitial pattern. You see the adenopathy here on this radiograph. So sarcoid initially presents again with adenopathy. Later on, it then moves on to adenopathy and interstitial disease, and usually it ends with primarily interstitial disease.